Anjali and my project is on fungi and forgetfulness, and I'm proposing as a possible novel treatment for the symptoms of Alzheimer's. Alzheimer's is a more recent prevalent age-related neurological disease, so as people's lifespan are living longer, the predominance of this disease is on the uprise. Alzheimer's is caused by the toxic dominant of the beta amyloid pathway. This pathway produces two neuron toxic productions. These productions are beta amyloid plaques and the increase of these plaques and tangles actually lead to the increased symptoms of Alzheimer's, such as personality and behavioral changes, like mood swings, increased anxiety, depression, and the most common symptom, or most well-known symptom of Alzheimer's, is the loss of memory and motor skill and function. The two mushrooms we're talking about today is Psilocybe cubensis and Hericium areneus, also known as lion's mane, because the tassels remind us of the fur on a lion's mane. Psilocybe cubensis is a psychedelic mushroom where lion's mane is not. To define the term psychedelic, some people will get it confused with psychoactive or a psychedelic. A psychoactive substance is a substance that alters your mental state, such as caffeine, nicotine, alcohol, whereas a psychedelic substance has a profound change on our perception, such as vivid hallucinations and altered states of consciousness. To talk about the neuron toxic production, we have beta amyloid plaques and tau protein tangles. So amyloid precursor protein is a transmembrane protein in the membrane of the brain cell, also known as a neuron. And this transmembrane protein is known for its neuronal growth and repair. So on the right side, we have the non-amyloidogenic pathway. This is when amyloid precursor protein is cleaved by alpha secretase, and you will get a P3 peptide, which is known for its neuronal growth and repair. However, due to gene mutations or inheritance of this disease, you can get on the left side, amyloid precursor protein will be cleaved by beta secretase, which causes the amyloidogenic pathway. This cleavage will produce beta amyloid, and because beta amyloid is insoluble, its hydrophobic residue will crack together and aggregate. These aggregations will actually weave its way in between neurons and dendrites, and the connections will get disrupted. The triggering of amyloid plaques actually trigger the kinase to phosphorylate the tau protein, which tau protein is integral to the structure of the microtubule, and the microtubule is integral to the structure of our neuron axon. Our axons is what helps us communicate between neurons and send signals, see signals. When tau protein is phosphorylated, it actually causes the structure to conform on itself, and this is what is called the tangles, and this will disrupt their axon communication. These tau tangles and plaques cause neuroinflammation, so brain swelling, neuron apoptosis, so we have cell death, and the degradation of the myelin sheath. The myelin sheath is what encodes our axon right here, and the thicker the myelin sheath, the quicker the flow between axons and communication. And the withering of this myelin sheath can actually cause us to have slower recall in our memory. And because of the plaques, we have neuron communication blockage, and because of cell death, we actually get a loss of brain tissue and depletion of serotonin receptors, which causes the mood changes we see in Alzheimer's patients. This is a healthy connection of neurons, and this is a healthy brain. And in an individual with severe Alzheimer's, because of the loss of neurons, you actually reduce brain tissue. This is actually what causes the morbidity of the disease. You can actually lose neurons and information on how to digest food and how your heart will get to how it could be. Physical symptoms, so we have the mood disorders, which is the depletion of the 5-HT1 serotonin receptors. This leads to a decline in emotional regulation, increased anxiety, and depression. The memory loss symptom is due to the degradation of this myelin sheath and brain tissue. Because all this is happening in your brain, it actually leads to brain inflammation, and your body has an emergency response to this, and it will produce cytokines. However, with chronic inflammation and ongoing stress to the brain, too many cytokines act to worsen and increase brain swelling and injury. The first mushroom, Psilocybin cubensis. This mushroom produces psilocybin, which is known for its psychoactive effects. When psilocybin is digested, it is turned into psilocin, and actually resembles that very closely of serotonin. Unlike serotonin, psilocin is actually lipophilic. So our spinal cord is encoded in a fatty membrane, and since psilocin is lipophilic, it can cross from the blood-brain barrier and go straight from the blood into our central nervous system. And serotonin is lipophobic, therefore it cannot cross the fatty layer of our spinal cord. Psilocin is more effective than traditional antidepressants, as psilocin uses the 5-HT2 serotonic pathway. This pathway is actually adaptable, and we can increase our serotonin threshold, so we can adapt to increase more and more serotonin. It also reduces pre-existing neural inflammation, and the recommended dosage is 30 milligrams. In a double-blind study, this study focused on psilocybin therapy to treat depressive disorder. The doses ranged from 10 milligrams to 30 milligrams, and the control group was given 1 milligram of psilocybin or 250 milligrams of niacin, which was used as a placebo. As the results showed, patients given high doses showed a rapid reduction in depressive symptoms as early as 1 use or 1 week, and ongoing treatment was not needed. Compared to already studied commercial antidepressant drugs, they take generally around 2 weeks to actually take effect with daily administration, and you have to find a antidepressant that works with you. And this is a diagram showing the postsynaptic and presynaptic neurons. Our normal serotonin pathways use the 5-HT1, and psilocin uses the 5-HT2. This data shows that there's a positive correlation between the increase of psilocin in our blood and the occupancy of the receptors on the 5-HT2 pathway. And this shows that psilocin works directly with the plasticity serotonin pathway. Next is Hericium erinaeus, so lion's mane mushroom. This mushroom helps with increased brain cell growth, memory, and axon communication. This mushroom is abundant in chemicals such as pyrinosines and erinosines, which mimic nerve growth factors. These nerve growth factors actually protect us from these conforming chow tangles, and nerve growth factors increase enzymes such as insulin-degrading enzyme, which actually can break down these beta amyloid plaques. And lion's mane has actually been shown to regrow the myelin sheath on our axon that degrades in neurodegenerative diseases. The recommended dosage is 1 gram, so lion's mane is mostly taken in extract form of these chemicals. In the human study, there were 30 participants aged 50 to 80 years old with mild cognitive impairment. They were given around 3,000 milligrams of lion's mane extract. The cognitive impairment was quantified on a score of 1 to 30. All these patients were around a 20, a 1 meaning extreme cognitive impairment, and 30, no cognitive impairment at all. They were divided between a placebo control group and experimental group that we were given lion's mane extract over the course of 16 weeks. The results showed that after 16 weeks of supplementation, their average score increased 7 points, and one patient actually scored 30, which classified them as no longer cognitively impaired. However, termination of dosing by week 24, so just 8 weeks of terminating the dosing of lion's mane, they had actually all gone back to their previous cognitive score. So this shows that with lion's mane, that we need ongoing supplements. In a mice study, mice were given an oral supplementation over the course of two months. These mice were senile aging, which means exhibited poor memory and motor functions. After the 2-month trial, they had actually seen that they had reversed neuronal aging and increased neural cell proliferation. So they had actually increased the amount of cells that were in the hippocampus and cerebellum. This is what this graph shows. The cell base of the implemented group actually improved 2.5 times more than the cell frequency of their control counterparts. Currently, there is no cure for Alzheimer's disease, and most studies are done on animals and in test tubes, so more human studies are needed. Actually, 99.6% of successful reversals of Alzheimer's symptoms in animals do not succeed in human experiments, and it is a bit difficult to work with certain mushrooms, as magic mushrooms are classified as a Schedule I drug, meaning that there is no medically accepted therapeutic effects. This list also includes heroin, LSD, and marijuana. Patients with Alzheimer's have been noticed to be deficient in omega-3 and vitamin D, and mushrooms are the highest known non-protein source of vitamin D. And I believe the therapeutic effects of psilocybin outweigh its negatives. And I'd like to thank my grandma, Auntie Jones, for exciting my interest in Alzheimer's treatment and the cure.
Instead of using the actual mushrooms themselves, if we like synthesize these chemicals, maybe they would be more sort of accepted for research, that kind of thing?
Well, I feel that, so since psilocybin resembles that of serotonin, and in the other mushroom, these two chemicals mimic our own nerve growth factors, I believe that scientists could probably create their own mimicking of that. I feel that because of these different mushrooms, they also have their own benefits, such as vitamin D, and also you can have mushroom blends. So I only focused on these two mushrooms, but lion's mane included with other different types of mushrooms, you can have like as like a morning coffee, but you don't get that crash, it's just caffeine. So I feel like the mushroom actually has more benefits than if we just extracted and tried to make our own compounds.
Is there any negative impact of the long-term consumption of these mushrooms?
I haven't read anything on lion's mane. Psilocybin can, with ongoing, if you take too much, you can, within a dosage, you can increase anxiety and depression. So the 5-HT2 receptor is an excitatory serotonic pathway, whereas the 5-H1, which is used in antidepressants, is an inhibitory. So you get the pathway of the 5-HT1 is actually more calming, so you can calm down anxiety and stress. So if you ate your favorite foods, you would have like a feeling of well-being, whereas the 5-HT2 receptors actually is induced whenever you have something exciting happen. And so that's what gives the effect of magic mushrooms. Oh, I'm sorry, I kind of went off with that. I hope I answered.
What did you find to be the best delivery method for the magic mushrooms?
So with magic mushrooms, unlike, let's say, so with magic mushrooms, you have to ingest it. You can't heat them up or cook them because it actually kills the compounds in it and you don't get the effects of the mushroom.
In your study with the placebo set and the treated set, did they see any effects in the placebo, or were all of your results based off of the ones who were being dosed with?
With the placebo, so since it was double blind, they don't know if they received it or not, but I'm pretty sure the people with the higher dosage knew if they received it or not. And it was just shown that the niacin group, because of the placebo effect, they might have felt a little bit different, but the change was more significant in the higher group.
So when you were saying that the group receives like 7 points of increase, that was not the placebo group, that was the group that was actually dosed?
Yes.
Okay.
Yes, the controls, their score was 7.